I'm here with Dr. Byrd. Am I saying that right?
Yes.
Awesome. And Dr. Byrd is here with me, and we're doing a IG Live to talk about the COVID vaccine, and to also just kind of specifically focus on communities of color, especially the Black community. There's so much misinformation out there that's really harmful, especially because we've already seen, we're like 10 months into this pandemic, and we've seen
Yeah.
how vulnerable our populations are because of this misinformation. It's just making things worse. And
Yes.
so we wanted to come on here and share some facts. She's got so much knowledge that I want you guys to hear. So we're gonna be, chatting it up, and hopefully you guys will get some gems. And then what we'll do is that after this live is done, then it'll live here on our feeds, and then I actually have a YouTube channel. I'm gonna post it there as well, so other people can see it and watch the replay and get the knowledge. All right.
Perfect.
Excellent. So honestly, let's just get started. Why don't we both introduce ourselves? I'll start first, and then you can let them know who you are. So my name is Dr. Pennicott, and I'm a board certified pediatrician. I'm also a fellowship trained pediatric hospitalist. I am basically really passionate about educating families from everything from breastfeeding to all kind of the range of pediatric topics. I'm also an IBCLC, which stands for International Board Certified Lactation Consultant as well. And so, I love pediatrics and I love sharing knowledge. All right, Dr. Byrd, why don't you go ahead and introduce yourself?
Perfect. My name is Katrina Byrd, or my patients call me Dr. Byrd. So I did Med-Peds residency. I finished adult infectious disease fellowship, and I was recently board certified in that. And right now I'm doing, yes, and right now I'm doing pediatric infectious disease fellowship. So I'm really excited.
Perfect. So basically, she's been in training forever, and she's super, super smart. So we're super happy to have you here.
Thank you.
No problem. So first, I just wanted to start off to set the stage, to kind of just lay down some facts of where we are in terms of the COVID pandemic. The WHO labeled COVID-19 infection outbreak a pandemic on March 11th. So it's roughly been about 10 months that we've been going through this. And the US, unfortunately, has been just hit basically the hardest when you look at us on a global scale. So we make up about 4% of the world's population, but we are accounting for about 25% of the deaths. As of today, when I last checked about a few hours ago, the death toll is around 383 plus thousand of our fellow Americans who passed away due to COVID. And what the studies have shown is that communities of color have been definitely impacted more severely than Caucasian Americans, and that really holds true. It's not super surprising when you look at all other indicators. When looking at mortality, maternal mortality, all those different measures, we see the same trends happening. So unfortunately with COVID, again, we see the disparities are playing out. And so you have, for example, one of the last stats I saw was 1 in every 735 plus Black people were dying of COVID, when you compare that to, say, 1 in 1,000 Caucasians. So definitely a huge disparity. And so now that I've kind of talked a little bit about, some of the stats, I think, some of the reasons why that's happening is, we know that a lot of people in these communities tend to be frontline workers. So they don't have, the luxury of being able to telework or all those things. So they are just more out there and more likely to get exposed. A lot of our communities live in multi-generational households as well. There's multiple people living in the same house. And so again, increases the risk of, if someone in the house gets it, of other people catching it. And then there's just less access to care, right? So, okay, let's say you do get infected, then how does the treatments that you get after that pan out? We're seeing that that's a lot of times there's less hospitals in their community, or they may not have insurance, or just so many other issues that can happen. And really, systemic racism, right? That's a huge underpinning of a lot of the reasons why we have so much inequities within our healthcare system. So those are just some of the reasons that I wanted people to kind of think about in the back of your heads as we're having this discussion. So enough about me talking. Let's hand it over to you. Can you talk to us about the two different vaccines that we have available right now, the Moderna vaccine and the Pfizer vaccine? Kind of give people a sort of a basic foundation of these two different types of vaccines that we have right now.
Okay, so these are both mRNA-based viruses, based vaccines, but let's just go. Sometimes I think it's helpful to remember kind of how vaccines work. So in general, when you get a vaccine, it's usually given in the shoulder, for example, in the muscle, not the shoulder joint, but the muscle kind of in this area. Then a lot of times people have like maybe pain in this area. So once the vaccine enters your body, the immune system say, hey, this is something different. We haven't seen this before. And so the vaccine pretty much prompts the immune system to start making antibodies against whatever is in the vaccine. That's important because when you are subsequently exposed to that disease, the antibodies are already there, so your body is able to mount a pretty high immune response and ultimately protects you. So it will either protect you or prevent you from having severe disease. So in general, that's how things work. So in regards to the COVID, the Moderna and the Pfizer vaccine, it will basically, it's an mRNA-based virus because, you know, coronavirus is RNA, and that just tells you the type of genetic material it is. So that's two, it contains the specific sequence for the spike protein, because when we're developing vaccines, you know, we want to know like what's specific about this vaccine that we can create a vaccine against. So it encodes the spike protein, and this vaccine is basically given to you. The reason why we have to, a lot of times people ask the questions, why do we have to keep it at very, you know, low temperatures?
Right.
Why, you know, what is that's because the vaccine is mRNA based. RNA is kind of unstable, and once it gets to the body, it can easily break down. So that's why we keep it at very, very, very low temperatures in order to store. So another question sometimes people ask is, if I'm getting the vaccine, will the vaccine incorporate itself into my DNA and be inside of me forever? And that's the beauty of this type of vaccine. That is not going to happen. It's just going to stay stable enough for it to be in the body, to trigger your immune system, to create a beautiful response, and then it goes away.
Exactly. Yeah, and you know, the same excellent point that you made about RNA being unstable, the whole point is that it's actually eventually going to break down in your body. It's not, that's the whole point, is that it's not going to be there forever. You know, when we talk about cells, or we're getting a little bit into biology here, if you can flash back to high school, you know, we think about our cells and we think about something called the nucleus, which is sort of the home base inside the cell. That's where our DNA lives. The mRNA, which comes in the vaccine, does not go into the nucleus. It's not interacting directly with your DNA. That's not how it works. It stays on the outside. And like I said, mRNA, I like to think of it as like sort of instructions, right? Sort of like a handbook for your body to say, hey, there's this unique structure, like you said, from coronavirus called the spike protein. Here's how you make it. And then, you know, like you said, our body recognizes it. And I think something that's really important is that it gives you instructions on how to make the protein, not the actual coronavirus. So when you're getting the vaccine, you are not going to get coronavirus from the vaccine. I think that's another kind of common misconception that a lot of people have. And can you talk to us a little bit about the difference between the actual Moderna? So you kind of gave us a great foundation about vaccines in general and specifically the COVID vaccine, but can you talk a little bit more about the difference between the two options that we have right now, the Moderna vaccine and the Pfizer vaccine?
Yeah, so there actually aren't that many differences. So the actual structure of the vaccine is very similar, but some of the differences is that the dosing is different. So for Pfizer, it requires 30 micrograms, whereas the Moderna requires 100 micrograms. So that's one. The other difference is for the Pfizer, they're both vaccines that require 2 doses. However, the Pfizer vaccine only requires 3 weeks in between each dose, whereas the Moderna requires 28 days.
Mm-hmm.
So those are the primary differences.
Right. And then can you speak to what ages are approved right now to get the vaccine? I know, of course, because we have a limited amount of vaccines, we all know that our country is sort of rolling it out to healthcare workers first, and now 65 and older has been approved. But in general, what's the authorization for in terms of the age ranges?
Yes, so the Pfizer vaccine, the youngest age that is authorized for and basically what they published was age 16.
Mm-hmm.
However, for the Moderna vaccine, they only enroll people 18 and over. So for the Moderna vaccine, it's only approved for people 18 and over.
So that's a great point. Especially as a pediatrician, I know that that's something that a lot of parents are wondering. I do know that they are in the process right now of lowering that age in terms of getting data. So they're doing clinical trials and they're recruiting and adding younger people. I believe at least until 12, and I know some are going even lower than that. And once we get that data, I would suspect over the next couple of months that we'll see the age range start to drop as well in terms of who's approved.
Yeah, so actually the Pfizer enrolled people as young as 12.
Mm-hmm.
However, they really didn't have enough data to do the appropriate analysis to say, okay, this is a safe vaccine for someone that young.
Awesome. And then can you talk a little bit about pregnant women and lactating women? I think there's a lot of concern over women who are currently pregnant because they weren't included in the initial studies. And so there was a question of, is this safe? Can you speak to that point?
Yes. So for the FDA, after approving both the Moderna and Pfizer vaccines, said, hey, we need to do more investigation, see, how safe and how effective these vaccines are in pregnant women. But in general, we're recommending pregnant women get the vaccine. The ACOG, or the American College of Obstetrician and Gynecology, is recommending pregnant women to get these vaccines. Why? In general, especially if you get COVID later in your later trimesters, like 36 weeks and 36 weeks gestation and beyond, COVID can be very, 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 very severe because the further along you are in pregnancy, the more immunocompromised. So pregnant women don't have the same immune system. So that's one. And two, they're of course pregnant. So it's just harder for the lungs to expand as well as someone who was not pregnant. And we've just seen really serious cases of COVID in pregnant women. So they felt that the benefits of getting vaccinated outweighed the risk.
Yeah, and I think I love that last line that you said. It's so important. Everything we do in medicine is about risk versus benefit and weighing those two things. So for me as a pediatrician, when I look at the vaccine and, we're talking to, moms who are pregnant or moms who are breastfeeding, always got to look at what are the risks to you and your baby if you do get COVID versus the risk of a vaccine that has been studied, and we're seeing that, we believe that it's safe. Also, it's important to note that the Academy of Breastfeeding Medicine also, in addition to ACOG, said that they feel it is safe for lactating moms to get the vaccine. And really, there's no risk to the child that's breastfeeding. So that's really important.
Yeah. I think that I think we should remind our patients, how does this vaccine work? Okay, so I love what you said earlier. You're not being injected with the virus itself.
Right.
And sometimes there are some vaccines that are made from live viruses or viruses that have been inactivated. That is not the case here. It's only a piece of genetic material that isn't enough to actually create the virus in your body. So when you're thinking about the risk to the person who's getting the vaccine or your developing infant, in my opinion, the risks are relatively low.
Yeah, I would definitely agree. Definitely agree. And then can we talk a little bit? I want to backtrack a little bit because one of the biggest things that I hear is this vaccine was rushed. I don't trust it, or there's so much politics that surrounded the vaccine development, or maybe because of the person who was in office, and who was in charge of it. There's so much angst about the sort of timeline of this vaccine. And I think it is important for people to understand that they were not starting from like complete ground zero in January. For example, and I'm going to ask you, of course, to elaborate more, but the mRNA technology has been in studies and been looked at and being developed for several years. And even kind of the bedrock of this vaccine was already in development for several years. So it's not like they literally, okay, we're completely starting from ground zero. What they got in January is they got the sequencing of the vaccine from China. Basically, they uploaded it to the internet, so all the scientists around the world could take that sequence in and start running. But they weren't starting from base zero. So can you talk a little bit about the history of what was some of the research that's been done over the several years that kind of laid the foundation and allowed scientists to be able to move at an impressive rate?
Perfect. I love this question. So, just to take one step back. So, in general, when we think about, okay, I want to create a vaccine, where do we start? So, we start in laboratory and animal studies to see, okay, the type of vaccine I'm making, is it safe? Is it effective? Is it doing the things that I want it to do? So, this mRNA-based vaccine technology, as you stated, is not new. This is something that has been in development for years. Examples of other potential vaccine candidates have been vaccines for influenza, vaccines for Ebola. These are well documented in the literature. So the actual basic science in regards to laboratory studies, animal studies were done. So they said, okay, well, this is an effective way we can create a vaccine. So then the next phase, once you have the genetic sequence of the virus and you are able to create a target, then you submit and you create the vaccine, you submit your application to start a clinical trial to test, okay, now I have this vaccine. Is it going to work? Yeah. Is it safe? Yeah. And that's when once your vaccine candidate is approved, that's where we go into the phase 1, 2, 3, and subsequently 4 clinical trials. So phase 1 is usually healthy volunteers primarily, and it's a small number, primarily looking at, is the vaccine safe? Are there any adverse effects? 2, now you're starting to add people who have certain diseases that you may like. Okay, 1, you may not have totally healthy. 2, you may add people, for example, who have hypertension. Phase 3, that's when you are going to add a larger number of people, again looking at safety and is it effective. And then usually between phase 3 and 4 you get FDA approval, and phase 4 is a process where many people are vaccinated and you're again looking at, is it safe? Because by that time you found that it's effective. So lastly, one way in which this process was compressed is, for example, Pfizer combined phase 1, 2, and 3 together. Moderna did something similar. So they're running all of these different phases all together. And so instead of doing them in sequence, but they're having large numbers. For example, Pfizer had over 40,000 people. Moderna had only over 30,000 people, and that's each just in their phase 3 clinical trial. Right. So that was again, this is obviously, we aren't in normal times. We're in the middle of a pandemic. So they're doing this to decrease the amount of time and to get a vaccine out to people as soon as possible.
And I love the last line that you said, like, we have to consider the context that we're in. We don't really have the luxury of, okay, let's create a vaccine, let's study it, and then let's wait 5, 10 years to look at the long-term outcomes, and then we're going to give the vaccine, right? That's not plausible because in the meantime, we already have almost 400,000 dead in 10 months. You can imagine what would happen if we just sat on a vaccine that we had. So I think that's always important for people to remember when we say, well, it's too quick, we should study it for years. In a few years, millions could be dead, right? And so it kind of
Exactly.
it doesn't make sense. And and this really was about the global scientific. This is not just American scientists. This is a global scientific
Yes.
community. This is humanity coming together and coming up with something and doing something actually quite incredible. So I think really, this vaccine development, it really has been, a blessing that we've been able to get it online in the fashion that we have. So I think people hopefully can reshift their framework to think about it that way.
Yeah.
And hopefully
May
you're
I
still with
just,
us. You're a little bit
perfect.
choppy, but hopefully you can
Oh,
still hear me,
me, I
correct?
am? Yes, I
Yeah.
can hear you clear.
All
Can
right.
you hear
I'm
me
sure
now? I'm so
I can
sorry.
hear you. No, you're good. You're good. I'm sure the
Okay.
visual, it's a little bit choppy, but I'm sure it'll resolve itself. And
Okay.
so one of the other questions that I had is that, in speaking about the vaccine, oh, there you go. Now you're back on. And speaking about the vaccine and, feeling like it is kind of too fast, we kind of addressed that. But can you talk to us about what is the vaccine protecting you from? So is it going to mean that you're never ever going to get COVID if you get the vaccine? Does it mean that you can't transmit the virus to somebody else? Talk about A, the effectiveness that they found in the studies, and B, what is the vaccine? What did they study it for to show? So what is it actually hoping to do for people?
Okay. So in general, we want to vaccinate everyone to prevent infection. However, that doesn't mean that you 100% can't get COVID. So let me be more specific. So about like if you look at the Pfizer study, about 18,000 people received the COVID-19 candidate, the COVID-19 vaccine. And of those people who were vaccinated, a very small number, like less than 10 people, actually got COVID-19. So in that case, out of 18,000, you're looking at just like less than 10 people got the disease. And so then they're like, okay, well, this is something that is effective and able to prevent infection. However, it wasn't 100% because, like I said, a few people uh, did get the virus. So then when you're looking at hearing, okay, it's 95% efficacious, or, it's over 90%. So you're looking, basically that means that, the majority of the time you are not going to get infected if you are exposed and you're fully vaccinated. However, there still is a small chance that you can get the infection even if you're vaccinated. So that's why it's imperative that even once you're fully vaccinated, you continue to wear your mask, you
Yeah.
continue to practice social distancing. And so I think we'll see. Like, we are seeing that people who are getting, one shot of the vaccine or both shots and are quickly exposed to the virus, that they are getting COVID-19. So so it does take, even after you're vaccinated, a few weeks for your body to
Right.
mount a full immune response. And even in people who have a full immune response, a very small number of them will still get COVID. So basically the vaccine is designed to prevent infection, but it's not 100%, it's not going to prevent infection 100%. So that's why we still have to practice those, precaution measures.
Right, those basic measures that are really life-saving and are easy to do. And then the other thing that's important for people to know is you really got to make sure you get your second shot, right? So, I got my first Pfizer shot this past Saturday, so I'm going back in 3 weeks for my second one. But it's really important because even, let's say in 2 weeks or so after this first uh, injection, maybe my coverage maybe is 50%, 60%, somewhere around there. Maybe it's a little bit less. It kind of differs between different people. But it's really important that we want to emphasize that you get, both of the injections to kind of get you to that higher, safer level. And you're so right. It's really important that we wear masks and we continue to do all this stuff. I know a lot of people have, what I call pandemic fatigue. Trust me, we as healthcare workers do too.
Yes.
I know that you're tired of, washing. Well, hopefully you're not tired of washing your hands. You should be doing that anyway. But tired of wearing the mask and all those things. But unfortunately, we got to do what we got to do to get out of this. And, thankfully, we have a vaccine as sort of the beginning steps, but it's going to take a while to get to what we call herd immunity. Can you talk to us a little bit about what does herd immunity mean? Are we talking about a bunch of cows or, what are we talking about? And what's the number that we need to get there?
Okay, so I don't actually know the specific number, but let me talk about herd immunity. So basically, you want either let's say you have a group of 100 people, okay? So you want, if one person who comes in and is not vaccinated or never had the disease, you want the group around that one person to have either had the disease, enough of those people to either have had the disease or be vaccinated to protect the one person who has never had the disease and can't be vaccinated. So that is what herd immunity is. So let's use another disease as an example.
You can do polio.
Polio, yes. So polio, like herd immunity, I know for measles, like you have to have over 90% of your population vaccinated to protect the one vulnerable person who has never had the disease. I don't know the specific number for COVID-19.
I think that they want at least somewhere around 70+%. I don't know the exact number either, but they want a high enough level. So it's going to be a challenge, of course, to get there. To ramp up production, and then also to convince people, hopefully, to actually take the injection.
Yeah. So let's talk a little bit about natural infection versus actually getting vaccinated. I think that's a really important discussion. So because there have been arguments, why can't we just wait until everybody gets the disease and then we don't have to worry about it? Okay. As we wait for that to happen, how many people are going to have to die in order for everyone to get the disease? So an alternative, is to vaccinate as many people, then people don't have to, die. So so that is the alternative. Instead of waiting for people to, everyone to get it and having people have breathing problems and, lasting effects from COVID infection or death, we want to vaccinate people instead. That's one. Two, natural infection is unpredictable. We don't know if you're going to have no symptoms. We don't know if you're going to have a lot of symptoms. We don't really know how much of an immune response you are going to create. So some people are like, well, I had COVID in March. I don't need to get the vaccine. I would argue, yes, you do. Okay, because we don't know if you still have enough antibody to protect you now that it's January. So this is another reason, because the vaccine, so when you look at the studies, the reason why we have to do 2 shots is the first shot it only gives you enough vaccine to produce enough antibody that's similar to if you had natural infection. However, that second shot supercharges you. You have like a lot of antibody, and that's going to be just super, super high. And our hope is that it stays with us for a long, long time. I don't think we know yet if you're going to have to get revaccinated in a year or so, but we're just trying to get the vaccine to as many people as possible.
So many great points that you just made. I really like how you talk about it's not just a discussion of death, but it's also about people who got COVID and had severe disease and are going to live with ongoing disability from that disease. And you think about how it's going to impact their life going forward, right? We know, for example, there have been athletes who've end up having myocarditis with COVID, and myocarditis is basically sort of inflammation of the heart muscle, and so they end up having issues, need to be followed by a cardiologist. People can have ongoing, breathing issues. So it's not just alive or dead. There's a whole spectrum in between of people living with the after effects of COVID. And again, we are learning, right? So we don't know how long some of these effects might last. So those are things that are really important. Another thing I'll say is, sometimes people will say, oh, well, most people survive. It's just a small number. That can be a very callous way to look at things, right? Because, if it's your family member that's in that quote small number, it destroys your entire world, right? So we really need to have compassion for our fellow human beings. We don't know. COVID is almost seems sometimes random. We've heard in the news over the past, I would say, month or so, some senators and, House of Representative folks who, one just got elected the other day. He was 41 years old, got COVID, and he passed away.
Yes.
Seemingly healthy, has young children, was married. So it's not just, okay, if you're 75 and older, or if you have pre-existing conditions or, obesity or whatever. We are seeing younger people who are getting severe disease. We're seeing younger people also die from it as well. So that's, speaks to the point of what you were making and why it's really important for people to get vaccinated.
Yeah, in kids, what we're seeing is something called MIS-C. So it's like a multi-system inflammatory disease. Mm-hmm. So kids are exposed to COVID and they may have no symptoms, or maybe they have a little cough. And weeks later, I think the longest I've seen is 2 months later, a kid comes in and they are extremely sick with fever, with rash, with extremely low blood pressure to the point where they need to be admitted to the ICU and given medication to boost the blood pressure. We're giving them medication, IVIG. We're giving them steroids. Sometimes they need to be intubated or be on a breathing machine, and they are very sick, and the parents are devastated, crying, is my baby going to live or die? And kids, they may not have, severe symptoms. They may not have any symptoms when they're exposed. So just like we don't always talk about the children, but this is like someone coming in with MIS-C, like as an infectious disease doctor, I'm usually the one that's called. My heart drops, and my heart does go out for the child as well as the parents.
Yes.
So that's something we're not really talking about on the news, but it's something that's really a big issue too.
Exactly. And, I know the narrative that has been that, okay, most kids do well, which is true. I mean, I've been a hospitalist and I've been admitting, these kids. That is true. But we also have to think about, again, that small population that does end up getting that severe disease. For any child that gets severely sick, it's a complete devastation to the family and to the community, and it's awful. So, all these things are really important for people to take in. Don't just think, okay, well, maybe it's only the death rate in kids is whatever it is, super small. We can't think like that. And in order to protect our children, to protect our babies, because we also have babies who are COVID positive. I've admitted, I think maybe the youngest I've admitted was about 5 weeks old that had COVID. They're getting it from, their family members who are visiting, etc. So because right now vaccines are not approved for the kids, it's important as the adults in the household, once you become eligible to get the vaccine, to get it to help protect the younger ones, the little ones in your home and in your community.
Yes, I agree.
So let's talk a little bit more. I want to talk a little bit more about, we've heard on the news a lot about, vaccine sort of hesitancy, in communities of color and why that might be. And so I want to speak a little bit about that. I think there's been such an unfortunately long history in this country of mistreatment, obviously going back to slavery, but then if you're thinking more recently, where the medical community, there's many, many examples of mistreatment historically. And so it has really kind of created sort of a bad taste in a lot of people's mouth and become, sort of distrustful and almost fearful of the medical community because of, the knowledge of one of the things that's highlighted probably the most is the Tuskegee experiment or study. And I want to highlight that because I hear a lot of sort of misinformation, even when people retell the story of Tuskegee. So for those of you who don't know, or those who think you know, Tuskegee was an experiment where they observed Black men in the South from 1932 to 1972, so it was going on for 40 years, where they observed the course of syphilis in these men who were infected. So they got infected naturally. They were not injected with syphilis. I think that's one of the first things that a lot of people get wrong is they think that these men were injected with syphilis. And so they kind of get scared with COVID, like, is this, I've heard a lot of people come to me say, well, I don't want this to be like Tuskegee all over again, in terms of the vaccine. And I say, no, these are completely different things. So this, experiment that they were doing, they were watching as what syphilis would look like in these men over the course of their lives, even well after, decades after we learned that penicillin, a medication, a drug, can eliminate syphilis. So, these men died from syphilis. They passed it on to their wives. There were children who were born with congenital syphilis. So you can think of the horrendous, legacy that left and mistrust that's happened in the Black community. The other thing I want to speak to is that even today, a lot of times, systemic racism is kind of built into every little part of our society. And a lot of people are not treated the way that they should be, even when they're seeking care. One of the cases that was recently highlighted within the past few weeks is Dr. Susan Moore. I'm not sure you might be familiar with her. Actually, Kamala Harris tweeted about her. Dr. Susan Moore is a Black female physician who got COVID in December. And basically, she filmed herself while she was in the hospital on oxygen, telling her story, saying that she was afraid, that she felt like, no one was listening to her. She felt like she was having racist treatment. They weren't listening, acknowledging her pain. They weren't acknowledging, the medications that she needed. And of course, she's a physician. She knows the normal protocols. So she was aware and she felt like she wasn't getting the proper treatment. She ended up being released home, and 12 hours later, she got worse and went to a different hospital. When she got to that hospital, she ended up having to go to the ICU, and eventually she passed away from COVID. And to me, that story and seeing her video kind of broke me, because it shows, even if you are well-educated, even if you're kind of savvy about the healthcare system, it doesn't necessarily absolve you from being affected through, systemic racism. So I think all these different issues that our country doesn't always attack head on and acknowledge are the things that sow the seeds of mistrust in our communities. And what it's going to take is really us as the medical community is rebuilding back trust brick by brick, starting with acknowledging that, yes, systemic racism affects health outcomes. Yes, we need to do better about listening to our patients and, meeting them where they are. So I think all of these things are really important. And that's why we're having this discussion to, of course, talk to everyone, but also specifically speak to our community to kind of break up some of these myths that come along with the mistrust. So let's move into that section now. We're going to do a myth busting section because I can't tell you how many times I get family members saying, I saw this on WhatsApp, or someone sent me this random YouTube video from some guru saying XYZ. And so I was like, let's start to clear the air about some of these unfortunately commonly held misconceptions. So first thing I want to talk about is the myth that the vaccine can cause infertility. Can you speak to that myth?
So there is no evidence that the vaccine can cause infertility. I think this was like a rumor that unfortunately just kind of blew up because again, this goes back to these vaccines are made by RNA. RNA is very fragile. So once it's in the body, it's just there long enough to create an immune response, and then it goes away. It's broken down. So for it to, stay in the system long enough to go down to the ovaries or go down, into the sperm and really cause infertility is, in my opinion, an overreach. There is no evidence, although we have to acknowledge that the long-term effects of getting the vaccine is unknown because the vaccines were just created. So I will acknowledge that fact, but there is no evidence, and I can't think of, scientifically how that is even feasible.
Exactly. The next myth we actually already busted earlier is that the vaccine gives you COVID. So we already demystified that one.
Yes.
The next one yes, false. The next one that I hear a lot is that giving this vaccine is somehow going to trigger your immune system in a way that you're going to develop an autoimmune disease that's going to stay with you for the rest of your life. So, for example, that you might develop diabetes, or you might develop, some other type of autoimmune disease. And so a lot of people are like, well, I don't want that. There's something that might stay with me for the rest of my life.
Yeah. So in general, this is false. So a couple autoimmune diseases that I want to specifically address that people may be worried about are like rheumatoid arthritis, or RA, lupus, or Crohn's disease, inflammatory bowel diseases. These are some of the more common autoimmune diseases, and vaccines flat out don't trigger these things. The other thing that you may have heard is sometimes people talk about the Bell's palsy or some neurological diseases like Guillain-Barre disease, which is basically when from the feet, we call it ascending paralysis. Basically, it starts off with numbness, tingling in the feet, and that kind of moves up the body. There really hasn't been a lot of evidence that these vaccines cause this. However, vaccines have in the past, caused that particular autoimmune kind of manifestation. So, however, this is
just to clarify, you're talking about the Guillain-Barre. You're talking about that's the one that, just to clarify for those watching.
Yes. Thank you so much. So I'm specifically talking about Guillain-Barre, extremely, extremely, extremely rare. And just to kind of add more reassurance, there's a program called Be Safe, in which anyone who gets the COVID vaccine is a special kind of monitoring system for adverse side effects. We also have VAERS, which is another kind of national adverse reaction monitoring group that looks for adverse reactions to vaccines. So adverse reactions are extremely rare. However, we are doing our due diligence to monitor for anything, especially since this is a new vaccine.
Excellent. The next myth we also sort of discussed about how the vaccine can permanently alter your DNA. Sometimes people joke, "Oh, are you gonna grow a third arm, or you're gonna grow a tail?" So
yeah,
it does not alter your DNA, correct?
That is correct. It does not even incorporate itself into your DNA. It's just there,
it doesn't even go
and then
into
it's
the
gone.
home of the DNA.
Exactly.
Awesome. And then the last myth I want to talk about is that the vaccine can be harmful to the fetus or the growing baby, and somehow that it might affect the child that's in the pregnancy.
Yeah, so we don't have a concern about that at all. I think that, initially, obstetricians want to know, like, if mom gets the vaccine, how is it going to affect her body? And again, this is not a vaccine that's going to go through the placenta and affect the baby at all. For most people don't feel many side effects outside of, a little headache, a little fatigue, some soreness in the injection site or body aches, but this is not a vaccine that's going to make you severely ill to the point where you're going to get hospitalized and we really worry about the fetus. So I am not worried about infertility, to bring that back again, and I'm not worried about if you were pregnant, would this affect the fetus? No.
Right, exactly. And then I want to touch a little bit on what you kind of brought up, some of the sort of side effects of the vaccines or things that you might experience. So just so we can kind of talk about that a little bit. So I'll speak from my own personal experience. So I got the first dose of the Pfizer vaccine, like I said, this past weekend. And for me, it actually didn't hurt going in, which was surprising because I actually don't like needles at all. But going in, I really didn't feel it much. I would say I only had about 24 hours of just sort of feeling tired, more tired than usual. And I kind of knew to kind of give myself time off to, just prep myself in case I had, more reactions than that. But basically, I took a little bit more naps than I normally would, but then I was like back to my normal self. I do know that other people, like you mentioned, they might have had headaches, they might have had more intense pain at the side. Sometimes you might have some localized swelling. That's actually very common, especially at the pediatrician. We see that all the time, just in other vaccines in general. Some people, may have a little bit of fever. They may have, more extensive symptoms. And then can you talk to the trend that we're seeing that after the second vaccine, sometimes you might have more of a reaction? Can you talk about that?
Yeah, so people are saying that after they get the second vaccine, if maybe they had a few symptoms the first time or no symptoms, they're feeling more fever, more body aches. Those are the primary things, headaches. Some people have said that these symptoms have been so severe that they've had to take the next day off. And what I'm primarily hearing is it's not the day that you actually get the vaccine,
Right.
it's the following day
Mm-hmm.
that you are feeling really, really crummy.
Mm-hmm.
I personally was lucky in that I didn't feel that way. I'm fully vaccinated with the Pfizer vaccine.
Mm-hmm.
The first time I did have quite a bit of pain in the arm the first day as well as the second day after the day of the injection, and then the subsequent day after that. I experienced headache and fatigue that next day, but other than that I was totally fine. The second time I got the vaccine in the same arm, I was like, I didn't even feel anything. I didn't think I was
Right.
vaccinated. I just only had a little bit of soreness for a few hours, and then that was it. So I feel that, I think a lot of times people feel fear that, oh my goodness, well, this person had this, huge reaction, I'm going to feel sick. I have to, preemptively take a day off. And I personally didn't have that experience. And other people, don't necessarily have severe reactions. You just you don't know unless you
Right.
typically have really bad reactions to vaccines.
Right.
So everyone has a different experience.
Can you talk a little bit about, I think at first was, reported in UK where they were saying, well, oh, so and so had a anaphylactic response to the vaccine. And so that kind of really scared a lot of people of, this sort of allergic reaction and who should take it, should other people not take it? Can you talk a little bit about that?
Yeah, so in general, when we first started vaccinating people, the advice was if you've had anaphylactic reaction to any IV medications, whether it was contrast dye or just any IV meds that you may want to avoid. But so typically this anaphylaxis is happening in patients who've had a history of
Mm-hmm.
anaphylaxis. So this is something that, that a lot of people are being asked about before. The other thing is the polyethylene glycol that's in the because it's not just the vaccine, you need preservatives and you need fluid and other things to make sure that the vaccine is stable before it's injected. So sometimes people have allergies to this. So it's not anaphylaxis and primarily it's not anaphylaxis in someone who's never had anaphylaxis.
Mm-hmm.
It's anaphylaxis in people who have had a history of this.
Right.
And so for our hospital, it's not a contraindication or mean and that or that you absolutely can't get the vaccine. You really should have a discussion with your doctor to, determine if, the vaccine would be safe for you. And we actually have a clinic where we have people who either have severe allergies in general, allergies to IV meds. They're able to get the vaccine and they're monitored a significantly longer time than someone who just, who doesn't have a history of allergies. And remember, we are monitoring people after they get the shot just to make sure that they don't have any, significant reactions to.
Exactly. So after I got my first shot, then they moved us into another room where they had water and crackers and other stuff there. And so they watched us for about 15 to 20 minutes or so. And then you were on your merry way. So excellent. So
Sounds like I should have gotten vaccinated where they didn't give us any water or
I got
crackers.
animal crackers. I was very happy. So since we're kind of coming up on an hour, I do want to start to wrap it up. First, I want to thank you, Dr. Byrd, so much for joining me and dropping all the knowledge. I really, really appreciate it. And it's so important that people get accurate information. That's the one kind of gem I want to leave people on is you got to be, anyone can put anything out onto the internet, but you got to know where is the source of the information coming from. So things, looking at what's the background of the person saying that. If they're just Pookie from the internet saying anything or
Yes.
so-and-so from WhatsApp, right? You want to think about, okay, what's the basis for what they're telling me? So I always want to encourage everyone who's watching to always talk to your physician, right? So even though we both are board certified doctors, we are not your doctor. So, and this, none of this is a medical advice. This is just an educational session. So we encourage you to have the conversation with your physician about getting the vaccine. I think that's really, really important for people to know and to make sure that where you're getting your sources of information are accurate. And can you tell them about the website that you were telling me about? That's so great.
Yeah, so I encourage everyone to go to preventcovid.org. So again, that's preventcovid.org. I actually really like it because it kind of breaks down all the different types of vaccines that you're hearing on about on the news. It talks about what is a clinical trial. It also, if you're interested in being a part of a clinical trial that's near you, because they're still ongoing, there's still other vaccine candidates out there, you can sign up if you're interested. But it's obviously no pressure. There's so much good, accurate information out there. I would also go to the site and follow the group on Instagram as well as Facebook because they are constantly putting out good educational material also.
Excellent. And Dr. Byrd, where can people find you?
Okay, so you can find me on IG. So it's Dr_K Byrd. So I also on my Instagram account, I have YouTube channel. So those Twitter is same handle Dr_K Byrd. So you can find me there. You can DM me. You can do all these things. I'm always available to answer questions. And thank you for this opportunity. I really appreciate it.
No problem. And I also have a YouTube channel that I'm going to plug, which my goal this year is to be consistent. Goal is to get about a video out a week, but it's the same handle as my Instagram. It's my name, Dr. Pennicott. So again, thank you so much for joining me. I hope that this was helpful for you guys. And we're going to keep the conversation going. Maybe we'll come back at another point. And yeah, thanks for connecting with us. We'll see you later. Bye.
Bye.